And good evening once again. I'm Mike Meeback.
And I'm Jana Katsuyama.
San Francisco's Department of Public Health expects to receive at least 4,000 doses of monkeypox vaccine tomorrow, a much needed boost as cases do spread and demand for the shot outstrips supply.
Tonight, we spoke with a Bay Area man who has contracted the virus. He is in isolation right now, but he shared his thoughts. New at 11, his firsthand experience and frustration.
I'm on day 18 of quarantine. I pretty much started on July 1st.
Stephen Ferris says it was the week after SF Pride that he learned he'd been exposed to monkeypox. He immediately got a vaccine, but the next day, the monkeypox symptoms began.
The flu symptoms lasted for like 3 days. They were pretty bad, and as soon as the flu symptoms kind of went away, the pox started spreading, and it took about, they spread for about a good week and a half.
Ferris shared these photos of his lesions. He is one of some 80 people in San Francisco who have confirmed monkeypox cases. He says it's been a challenge getting information on how to treat the lesions.
There's a lot of mixed information, like, do you keep the sores dry to help them crust quicker, or do you use healing ointments?
Ferris says he's been in touch with friends across the country, sharing information.
I've known friends who got it that weren't having sex, and they got it just from casual touch.
San Francisco ran out of monkeypox vaccines last week and is set to receive a new batch on Tuesday.
Our local Department of Public Health is hearing from our state contacts that we should have another 4,000 plus or minus vaccine doses arriving.
San Francisco Supervisor Rafael Mandelman says the city needs 35,000 doses.
I think people are frustrated, angry. I think people who went through the AIDS crisis in the 80s and 90s are feeling a little bit of PTSD around this.
People's physicians don't know how to treat them.
State Senator Scott Wiener and community leaders held a rally outside the federal building in San Francisco Monday, calling for action. And House Speaker Nancy Pelosi also sent a letter Monday to Health and Human Services Secretary Xavier Becerra, saying California alone needs at least 350,000 doses just to vaccinate the highest risk residents. Nationwide, there are more than 1,800 confirmed monkeypox cases. The federal government has ordered nearly 7 million doses, but most aren't expected to arrive until next year. Ferris says health officials told him he could need to isolate for a month or more because people can be contagious as long as they have the lesions.
You have to wait 2 to 4 weeks for the sores to crust and fall off.
And for information on monkeypox symptoms, testing, and where to go for information on getting a vaccine, you can go to KTVU.com. Just click on web links to reach the CDC and Department of Health information pages. Right now, health officials are saying that people who have known exposure to the virus are getting top priority for those vaccines.